You do need to know about the Herring-Brewer reflex, which is what's known as an inflation reflex. The stretch receptors in the pleura and in the airways are going to be stimulated by the inflation of the lungs. There are inhibitory signals that are going to be sent up to the respiratory centers in the medulla, which will trigger expiration. When you talk about the Herring-Brewer reflex, it prevents overinflation of the lungs on inspiration. So it is a protective mechanism more than a normal regulatory mechanism. And again, the Herring-Brewer reflex will prevent the overinflation of the lungs. High altitude can really cause problems with respiratory systems. So if you are quickly traveling to altitudes that are about above 800 feet or so, you may have symptoms of acute mountain sickness. And that is because the pressure in the atmosphere and the levels of oxygen are lower than at sea level. Patients will exhibit headaches, shortness of breath, be nauseous, be dizzy. And if the cases are severe enough, you may end up with cerebral and or pulmonary edema that can be lethal. So this needs to be taken quite seriously. In order to prevent this, you need to acclimatize toward too high altitudes. So there is a series of respiratory and hematopoietic adjustments that occur with long-term exposure to high altitudes. The chemoreceptors become more responsive to carbon dioxide when the partial pressure of oxygen declines. If you have a substantial decline in partial pressure of oxygen, that will directly stimulate the peripheral chemoreceptors, which means that the minute ventilation will end up increasing and will start to stabilize within the space of a few days to between 2 and 3 liters per minute higher than what is ordinary at sea level. There is always lower than normal saturation of hemoglobin because there's less oxygen available. So decline in blood oxygen makes the kidneys begin to produce erythropoietin, and the numbers of the red blood cells are going to increase slowly and provide a long-term compensation. When you talk about COPD, this is going to be exemplified by both or chronic bronchitis and emphysema. It is an irreversible decrease in your ability to force air out of your lungs. Common features include a history of smoking, 80% of patients, dyspnea, which means air hunger, so you're going to have labored breathing, coughing, frequent respiratory infections, and most patients will develop respiratory failure, which is going to go hand in hand with respiratory acidosis and hypoxemia. So there are different symptoms in patients depending on a couple of things. There might be, patient might be thin, but basically have near normal blood gas levels. Those are considered the pink puffers. If the patient is stocky and hypoxic, those are going to be the blue bloaters. And you treat these with bronchodilators, corticosteroids, oxygen, and occasionally surgery. Emphysema is a permanent enlargement of alveoli. The alveolar walls get destroyed. You're going to have decreased lung elasticity. Patient will end up using the accessory muscles for breathing. And go ahead and name those accessory muscles. Go do a little research and figure out what those were. We have not spoken about those. I was going to do it during this period, but I'll give you the opportunity to check that out yourself. And the patients become exhausted because they are using a ton of energy in order to be able to breathe. Hyperinflation leads to an overflattened diaphragm, and there's going to be reduced ventilation efficiency. There will be damage to the pulmonary capillaries, and the right ventricle will have to work harder and harder and harder, so it will become enlarged. This shows you a pink puffer and lists some of the symptomatology, signs and symptoms that you might see, and I would know these if I were you. Pink puffers tend to be thin. This talks about the pathogenesis of COPD, tobacco smoke due to tobacco smoke or air pollution. And this is a nice diagram for people who need a more visual input. The blue bloaters are associated with chronic bronchitis, and that lists the signs and symptoms, and those would also be good to know. Chronic bronchitis can be triggered by inhaled irritants, which leads to the development of excess mucus chronically. You may have inflamed and fibrosed respiratory passageways in the lower part of the respiratory system. If you have obstructed airways that go hand in hand with this, you end up with impaired lung ventilation and therefore impaired gas exchange, and you have frequent infections of the respiratory tract. Asthma is reversible COPD. Generally, patients who are asthmatic have coughing, dyspnea, wheezing, chest tightness. Active inflammation of your airways precedes the bronchospasms associated with asthma. The inflammation of airways is an immune response that is going to be caused by the release of interleukins, the production of the immunoglobulin IgE, as well as the recruitment and activity of inflammatory cells. The airways are thickened because of inflammatory exudate, which will increase and worsen the effect of those bronchospasms. TB is on the rise. It is caused by a bacterium. Symptoms include all of those that are listed there. Treatment requires 12 months of antibiotics, and unfortunately there are antibiotic resistant strains that are out there because of our overuse of antibiotics. Lung cancer is the leading cause of cancer death in this continent, and 90% are the result of smoking. There are 3 more common types: adenocarcinoma, squamous cell carcinoma, and small cell carcinoma. None are pretty. About 40% of the cases are going to be the adenocarcinoma. It is going to start in the peripheral lung areas, in other words, bronchial glands or the alveolar cells. Squamous cell carcinoma, about a third, give or take, which will start in the bronchial epithelium. And small cell carcinoma is the least common type, with about 20% of the cases. You have lymphocyte-like cells that are going to arise in the primary bronchi and subsequently metastasize, which is quite awful. Early detection of any cancer, and particularly lung cancer, is going to be the key to survival. If you suspect lung cancer, a helical CT is going to be better than a chest X-ray. They are developing a breath test with gold nanoparticles, which is kind of cool. If there is no metastasis, the patient will undergo surgery to remove the cancerous lung tissue. If there is metastasis, radiation and chemotherapy will occur. There are a number of new therapies that are being developed and tried. There are antibodies that target growth factors that are required for tumor growth. or which will deliver toxic agents into the tumor. There may be some vaccines that will stimulate the immune system, and there may be gene therapy in order to replace defective genes. What is pneumonia? Watch that video and find out. And that's the end of the respiratory system.